Good afternoon. Our goal is to be entertaining enough that the lunch you just had won't interfere with your ability to pay attention. Um, Peter told me I could just go ahead and get started. I'm Jeff Ward. I'm a practicing oncologist in Edmonds, Washington. That's an aging community just north of Seattle. 3 years ago, I was an independent practice with 8 partners. 2 years ago, we became a hospital-supported foundation, and for the past year, I've been employed by the Swedish Cancer Institute, a 340B eligible institution. So a lot of what you're hearing about today and what you'll hear about somewhat in this panel is what I've lived the last number of years. My bio will tell you that I've also been very active in payment reform efforts of the American Society of Clinical Oncology. And that has been a revelation to work through some of the work that we've done there. A general theme spanning the last several ASCO annual meetings, attracting greater than 30,000 oncologists around the world, has been this idea of personalized medicine or patient-centered care. What that means may depend on one's perspective. I'm not sure that it means the same thing to patients that it always means to doctors. But at its core is the idea that each patient is unique, and as they are unique, so their cancer, a microcosm of evolution, is also unique, and that includes unique weaknesses for each cancer that can be targeted by specific and often very expensive drugs. The hope is that personalized medicine will be more successful than the relatively indiscriminate carpet bombing that we have used previously, and that with pathways we'll have more success, greater value, and yet it will be at lower overall costs. I hope that our panelists today will convince you that fulfilling the promise of personalized oncology will require bringing coherency to the drug reimbursement system as well, that it inherently incentivizes the use of more drugs, the most expensive drugs, more parenteral drugs, that hospitals, it pays hospitals more than independent practices for what can be argued as very similar processes, and it lowers drug costs for some special hospitals. At the same time, it bankrupts cancer patients and their families. The speaker's assignments are to shed light on some of these paradoxes of cancer drug reimbursement. Our first speaker is Dr. Peppercorn from Duke University, who's going to speak to the topic of oral versus IV drugs.